As the weather is getting warmer, many of us are starting to get out and be more active. Today, we are joined by foot and ankle specialist, Dr. Eric Gokcen, who is going to tell us about some common foot and ankle injuries and how to prevent them as we all begin to break out of our winter hibernation. Dr. Gokcen, thank you so much for joining me today.
Thanks for having me. It's a pleasure to be here.
Thank you. So I would love to hear about your background and what got you into this specialty.
Well, I did general orthopedics first for about 12 years. Then actually I went to Africa for 7 years and worked there and helped with some children's surgeries, started some hospitals. Did a lot of work there. And then I ended up coming back to the U.S. And then I did a foot and ankle fellowship specializing in foot and ankle. And then I was in California for a while, then locally here in the Philly area, now with Trinity at St. Mary's.
Wow, what a resume. That's amazing. Where in Africa were you?
I was in Kenya and in Ethiopia.
Wow, amazing. That's so neat. What kind of piqued your interest in foot and ankle?
Well, when I was in Africa, I did a lot of foot and ankle surgery because a lot of the children there have deformities that they're born with that needed surgery. And then when I got recruited to come to the U.S., the university that wanted me to join their staff wanted me actually be their foot and ankle guy. So it was kind of like I just did all this, and then at the same time, they were asking me to be the foot and ankle surgeon. And so I spent some time doing a foot and ankle fellowship in the middle of my career, which was really, really nice.
Neat. Well, yeah, that's so interesting. It was quite serendipitous how you landed there. So in terms of foot and ankle common injuries, I know we were talking earlier about people getting back outside after winter hibernation. Like this time of year and into warmer weather, what types of injuries do you commonly see?
Well, the most common is usually ankle sprains. Ankle sprains are probably one of the most common reason that people go to the emergency room or urgent care centers for ankle injuries. And as people get out and they start moving around more, you're on uneven ground. You can step in a hole, step off a curb. There's a lot of different ways you can sprain your ankle. So that's probably the most common thing that I see. But the other thing that's really common, especially this time of year, as the weather starts to get nicer, is that people are excited to get back out into the nice weather and start exercising, whether it's running or going for walks, and they do too much too quick. And so then there's a lot of we call overuse injuries that develop because of doing too much too fast.
That makes a lot of sense. And I know I've been guilty of that myself. So thanks for the reminder not to bite off more than I can chew. In terms of the degrees of twisted ankles, you said, the ankle sprain, twisted ankle is very common. Are there different varying degrees as to severity?
Sure. Some of them are just tweaking the ligaments in your ankle so it gets better really fast, and other ones can be completely torn. The great news with ankle sprains is that even if you have a completely torn ligament, they almost always heal back to normal without surgery or anything like that, just normal healing. And usually when I see patients with that, they just need to get put into an ankle brace for a period of time and just be patient. But I try to keep them as mobile as possible. One of the issues with ankle sprains is it's over-treating them, and then people get stiff and the muscles get weak and they actually take longer to get better. So the key is having the right kind of support around the ankle and also trying to mobilize the person and get them functioning as quick as possible.
Do you ever see overcompensation injuries, like if one foot is hurting, then somebody will put too much stress on the other one?
Yeah, that happens quite a bit. It's never really an injury, though. They just say, hey, my other foot's sore, my other ankle's sore. But it's usually, once they get better, it goes away.
Right, when you're distributing the weight more evenly. So in people getting more active, do you have any advice as we step out of our hibernation as to help prevent foot and ankle injuries?
Yeah, so the most important thing is don't do too much too fast. I try to tell my patients, even when they're recovering from surgery or anything where you have to slowly increase, is you're not training for the Olympics for next week. Take your time. There's no reason to push yourself. So start slow. If you feel any pain at all while you're doing something, then you should stop. If you feel pain afterwards, whatever you did was probably okay, but you just did too much. So back off on either the duration or the intensity of whatever the activity was. And just kind of listen to your feet and your ankles and your legs and slowly increase things. And if you do that carefully, then you've got a much better chance to get back to the level of activity that you want to be at without injuring yourself. The second thing is also the type of shoe wear you wear. If you wear shoes that are more supportive, when we say a supportive shoe, that means one where the bottom of the shoe is not real flexible, but it's more rigid. Those are going to be the most comfortable shoes. And fortunately, right now, those type of sneakers are really popular. There's several different brands that are all now making these shoes that have a really rigid sole to them. So when you walk, it doesn't bend your foot and put as much stress on your foot. So they're way more comfortable. And most people, when they try out these newer type of shoe designs, they love them. People rave about how comfortable they are.
I've noticed that you kind of saw a lot of those shoes in just like the running and active community. And now everywhere I go, I see people, which is great. Good for their foot health. What's your opinion on wearing shoes indoors or versus walking around barefoot?
If you've got normal feet, you can do whatever you want. If you have feet that have problems and have pain, then you want to wear a supportive shoe on your foot inside. So like for me, I have some of those sneakers that I just leave inside so they don't get dirty. So when I'm around the house, I wear them. Some of the companies even now make like sliders or flip-flops that have that same kind of design. Those are great like in the summertime when it's warmer and you want to wear something on your foot, like even just going outside a little bit, but not really going for walks to help support your foot.
Yeah, all about the support. You and I were talking a little bit earlier about plantar fasciitis. It's something that I think we've both dealt with. Do you have any tips, and this is just me personally asking, to help prevent my plantar fasciitis from coming back?
Well, the main thing is understanding what plantar fasciitis is. It's really a degenerative process where just wear and tear. This plantar fascia is it's sort of like a tendon that's on the bottom of your foot that attaches to your heel. And just from normal wear and tear, you just get pain from it. The reason that it doesn't go away is because it doesn't have a very good blood supply. And blood has all the oxygen and nutrients that tissues need to heal themselves. So anywhere in our body where we don't have a good blood supply, things don't heal well. And so the plantar fascia is one of those spots. And so there's a lot of different ways to treat plantar fasciitis, but there's really been only one major way that's been shown to actually make you get better, and that's doing specific stretching exercises. Because when you stretch the plantar fascia or stretch any tissues, it increases the blood flow to them, which is what it needs to heal itself. So I always tell all my patients, like, number one, you got to do these stretches. If you do the stretches, you'll get better. But you have to be patient because plantar fasciitis is good news, bad news. The good news is almost everybody gets better, doesn't need surgery or anything like that. But the bad news is it can take a long time. So you have to be really patient and stick with the stretches. There's other things out there that can treat it that are more advanced things. But for the average person, just doing the stretches gets almost everybody better.
Gotcha. Thank you. Well, that's very encouraging. Any other sorts of common injuries that you'd like to just touch on while we have our viewers? I know, a lot of people aren't in quite your specialty, but we are all hoping to be active. So anything else you'd like to touch on?
Well, I think along the overuse injuries, some specific things. One of them is stress fractures. If your bone gets too much stress on it too rapidly, then you can develop a stress fracture in the bone. So imagine taking like a coat hanger. If you bend it back and forth, it doesn't actually snap. If you keep going, it will, but it doesn't really have to snap. But you can see the integrity of the coat hanger is kind of starting to break. Well, that's what a stress fracture is. And so you can get a pain in your foot without actually having the bone break. And that always happens from trying to do too much too quickly. Bone is actually alive. It responds to stress. And so as you slowly increase your activities, the bone actually gets stronger in response to it, but you got to give it time. And that's why I was saying, if you feel pain, that means you're doing too much. And so you want to back off. And that's what's great about stress fractures is they hurt. Your body's telling you, you're doing too much, back off.
Right.
And then along the other lines is that people can get like Achilles tendonitis and other ankle tendons can also develop irritation, and they're all the same, very similar to plantar fasciitis and to stress fractures. It's like you're getting kind of wear and tear from trying to do too much too fast, and so you have to back off on your activities to allow these things to not become a chronic problem.
Right, and to heal. That's good advice. I think we should all heed, even though as the weather gets prettier. Anything else you'd like to add before we close our episode today?
I don't think I have anything else beyond that.
Thank you. If you happen to need a foot and ankle specialist in the greater Philadelphia area, Dr. Gokcen is always accepting new patients. You can find out how to make an appointment with him in the link in the description below. Thank you so much for joining us today on Beyond the Stethoscope. Be sure to hit the subscribe button and look out for new episodes every other Thursday.